Now I would like to invite to the stage the director of the Alliance for a Healthier Generation, which was co-founded by the American Heart Association and the Clinton Foundation, Dr. Howard Wexler, Susan Neely of the American Beverage Association, Wendy Clark of Coca-Cola North America, Roger Collins of Dr. Pepper Snapple Group, and Albert Carey of PepsiCo Americas. This commitment gives me particular pleasure to announce because I've been working through the Alliance for a Healthier Generation for several years now to try to stop the rise of childhood obesity in America and reverse it. And we are now in more than 20,000 schools with exercise and diet programs for students, for faculty, for staff. We're working increasingly on the out-of-school hours and how to make them healthier. It's been one of the most rewarding experiences of my life, and on occasion one of the most frustrating ones. But we're getting there. Today we announced a profoundly important commitment to combat the obesity epidemic by cutting calories in America's soft drinks outside of school and beyond children. Obesity is still a major health concern in our country. Rivaling tobacco use is a leading contributor to heart disease, cancer, and other fatal conditions. 1 in 3 of our children is still obese or overweight, an unprecedented threat to our future, and one that sadly has spread to other countries as well. Industry collaboration is central to the strategy the Alliance has embraced, enabling organizations like McDonald's and General Mills to become part of the solution. From the very beginning, the Alliance has worked with beverage companies to fight obesity, and in the very beginning, the 3 companies standing up here joined with some of the major producers of juices and made agreements to reduce the total calories in beverages shipped to our nation's schools, reducing the portion size, changing the mix, by agreement, with no law and no tax. According to 2 independent surveys, they have now reduced the total calories shipped to America's schools in drinks by 90%. But they'd be the first to tell you it sounds great, but kids spend a lot of their time out of school, and adults spend all their time out of school. So today they are announcing a commitment to reduce beverage calories consumed per person without regard to age or where they consume them by 20% nationally before 2025. They will launch a national calorie awareness program providing calorie counts and information on more than 3 million vending machines, self-serve fountains, and retail coolers, and they'll do it all within 2 years. They're committing to local interventions in urban areas where sales data proves that customers consume more full-calorie beverages and have more limited access to and awareness of healthier options. In these targeted communities, partners will implement new marketing and promotional campaigns for lower calorie options and incentivizing more water consumption. Now, at the minimum, this is significant because calories from soda and juice make up, on average, 6% of our daily caloric intake. But for some people who live with limited incomes and limited mobilities, calories from drinks can make up to 50% of the daily intake. So if you reduce this by 20% for the whole country over 2025, we're talking about average a couple of pounds a year across the board. But for some people, you're talking about a much bigger impact, and one that, if the eating patterns and drinking patterns stay, will be completely sustainable. And those of us who've been on yo-yo diets over the years, up and down, which I can tell includes people besides me, this is really important. This strategy can sustainably lower the aggregate weight of the country in a way that will dramatically improve health outcomes, reduce the risk of obesity and diabetes and its attendant consequences, and in particular cases can help us to reverse type 2 diabetes, which is profoundly important. So I want to thank all of these people for this commitment and for taking a flying leap. You know, when we started the Alliance for a Healthier Generation, and then we began to work with communities with our Health Matters initiatives to try to change all the health indicators, I was really reluctant in the beginning because I was afraid failure was assured, because changing a culture is like trying to turn the Titanic around before it hits the iceberg. And we have been able to make more progress than I had ever dreamed. And new people have played a major role, including the First Lady, Michelle Obama, and all the things she's done, and so many others. But the fact that this industry is prepared to do this and believes they can do good and make a profit by doing it in different ways is the beginning of the effort, without which, and I predict to you that if what happened in the schools is any indication, when this announcement is made and people see that they're serious about it, then other people who make snack foods and who do large-scale deliveries of food that pre-cooked and lots of other things, they're going to get a lot of partners, because people say, well, if they did this and they figured out how to do it, maybe we can do it too. This is a very big deal, and I think we should give them a big hand.